So chronic or recurrent ear infections in children is very, very common. How we equalize pressure across our eardrum is a tube that runs from the middle ear space to the back of the nose. That's why when you're on an airplane and the pressure changes, you yawn, you swallow. It's called the eustachian tube. When kids are born, the eustachian tube is more in a horizontal position, and then it will, as they grow and mature, it'll go more vertical. So while that's in a horizontal position, it doesn't work as well. And that causes negative pressure in the middle ear space. And then fluid accumulates and they get infections. So it's much more common for children to have ear infections than adults. As far as the number of infections where it becomes more of a problem, we usually say if you have 3 to 4 infections within a 6-month period or 4 to 5 infections within a year, then it's a good idea to put in ear tubes. And what ear tubes do is we make a little hole in the eardrum and put in a temporary tube that helps to equalize pressure across the eardrum so that fluid doesn't accumulate and the kids do not get recurrent infections. They last anywhere from 6 months to 2 years, and the body will get rid of the tubes on their own. They'll kind of work it out and they come out in the ear canal, and a lot of times they'll fall out in the bath, or if when the kid's swimming or at night, you'll never see them come out. We usually follow you on a regular basis after the ear tube. Sometimes we'll see the tube in the ear canal and we can just remove it from there. But what it helps to do is keep the middle ear space in a neutral position, so less negative, less fluid, and do that. And usually if you're getting that many infections, 3 to 4 in a 6-month period or 4 to 5 in a year, they're on antibiotics a lot, they're having a lot of fevers. The other indication for putting in tubes is if the fluid stays in the ear for 3 months or longer. And the concern with that is sometimes when the fluid's in the middle ear, they can't hear very well. So they feel muffled and underwater, and especially in younger kids, that's when they're developing their speech, so they're not hearing well. So persistent fluid, hearing loss, recurrent infections is when we remove that fluid. And then kids typically grow out of the ear tube. So some kids need 1 set of tubes. Sometimes they'll get a set of tubes, it'll stay in for a year, they'll come out, then the fluid will come back, and they'll need a 2nd or a 3rd set of tubes. But usually that's something we manage until their body grows and that tube can work better at equalizing pressure on its own.
Okay.